Hi Davis family. Today I'm here to talk to you about all the terms you may hear when discussing standardized test scores. So what's the purpose of a standardized test? These tests follow a specific procedure for how they are administered and scored. The same instructions, materials, and procedures are used for everyone. Tests are scored based on their provided test manual. Standardized tests are used to determine if a child is eligible for therapy services. They are a tool that monitor the child's progress in therapy and assists in making decisions about interventions. While standardized tests can be potentially the cause of some anxiety in children and only provide an idea of their abilities and behaviors, there is still a scientifically supported tool that is both valid and credible. They are a universal way of monitoring the progress of a child and can assist in developing an appropriate treatment plan. So what are some of the terms you may hear? First is raw score. The raw score is an unaltered measurement. It is the baseline score used to calculate other scores like percentiles and age equivalent scores. Then there is standard deviation. Test developers calculate the statistical average based on the performance of students. That score is assigned a value. Different performance levels are calculated based on the differences in student scores from the statistical average and are expressed as standard deviations. These standard deviations are used to determine what scores fall within, above, average, below average, and the average ranges. Standard scores and standard deviations are different for different tests. The number is the basis for computing many standard scores, as it shows how far the scores can be expected to range from the mean value. Then there is the standard score. This tells us how far a student's standard score is from the average or mean. The closer the standard score is to the average, the smaller the standard deviation. Next is percentile. So percentile ranks should not be confused with the percent of correct answers on a test. This is the percentage of people in a standardized sample whose score is at or below a raw score. So for example, a percentile score of 40 would mean that 40% of people in the standardization sample received a score that was at or below the raw score corresponding to the 40th percentile. Then there are age equivalents. This tends to be expressed in years and months, and an age equivalent may offer a ballpark idea of a child's overall developmental level. They can also be a little misleading though. So this score only represents the score that a child at the same age who is performing at the 50th percentile would receive. This means that a child who is performing within normal functional limits for their age but whose score falls below the 50th percentile would receive an age equivalent score younger than their chronological age. Then there is confidence interval. So within standardized tests, there is a standard error of measurement, meaning that the amount of error in standard scores that should be considered when interpreting the student's score. The smaller the standard error measurement is, the more confidence you can have in the accuracy of the test score. It is important to remember that measurement error is inevitable in all test scores, and that the observed test score is only an estimate of true ability of the child. Then lastly, there are z-scores. So a z-score is determined by subtracting the mean of the test from the individual score and then dividing it by the standard deviation. Negative values mean the z-score value is below the mean, and positive values mean the z-score is above the mean. A z-score of negative 1.5 or less is considered evidence of a deficit in the area assessed. It allows the therapist to determine how much area the specific z-score is associated with, and the exact area can be determined by a z-score table, typically found in a test manual. So what is the difference between medical-based OT and school-based OT? In medical-based OT, a referral is provided in the form of an order or prescription from a medical doctor. Once an order is received, an evaluation is completed. This may or may not include standardized assessments. Then progress reports are due at least once every 10 treatment days or once during each 30 calendar days for both hospital and outpatient settings. For home health, they are due quarterly. A child is discharged once all goals are met. In school-based OT, however, the child is identified to be at risk in areas that relate to OT. It is required that the parent and guardian must sign a consent form. An evaluation must be completed and again may or may not include standardized assessments within 90 calendar days of the signed consent. Progress reports are completed quarterly within the school year, and the child is just discharged when they no longer qualify for OT services or don't qualify for special education. Medical-based and school-based OT relate in that both treatment is based on the plan of care and established goals.